Carr, and she's going to talk with us a little bit about her story and her experience.
Thank you for having me.
Yes.
Hi, everyone. My name's Katelyn Carr, born and raised here in Pennsylvania. I'm a wife, a mother to 4 children, and a registered nurse for the last 12 years, 9 of which are in labor and delivery. I'm one of 4 nurses in my family, including my mother, who's also here tonight. I became a nurse because I genuinely care about helping people. I work the 12-hour shift, 7 p.m. to 7 a.m., so that I can be home with my kids and not have to pay for daycare. I just finished paying my last out-of-pocket medical bills for my 18-month-old daughter. I don't expect that my health care should be free. That's why I work. Over the last 3 years, I've observed a significant increase in the number of babies born to illegal mothers, whether they're uninsured or on Medicaid. Their health care is free. An interpreter over the phone is almost always needed to communicate the patient's history and the patient's reason for presenting to the hospital. Oftentimes, the patients are poor historians, or the interpreter poorly translates what the patient's saying. On occasion, I'm unable to connect to an interpreter for several minutes, not only delaying care for that patient, but for other patients waiting to be cared for. Because of the increasing volume of patients presenting to labor and delivery, patients often are held on the unit after they've delivered because there are no beds available on the mother-baby unit. This leads to unsafe situations where women are laboring in a small triage room, not equipped for an emergency situation. This includes fully insured American mothers who expect the highest quality of health care. The scary part of all of this is that I'm only speaking from a labor and delivery perspective, but I know the emergency departments are experiencing the same level of stress. On behalf of myself and others, and my many other friends in the healthcare field, we are burnt out. My concern is our healthcare system is overwhelmed and approaching a breaking point. Something needs to change. Thank you.
Thank you, Katelyn. Another important story, clearly. Healthcare, for us as moms, how important is healthcare, right? This is our family. This is our children's lives. Labor and delivery. So obviously something needs to be addressed and needs to be corrected and needs to be changed.
And that's another thing we've heard a lot from moms across the country.
We have Katelyn Carr from Pennsylvania.
First of all, Senator, I just want to say thank you for you and your family for the sacrifice you're making to make America great again. I appreciate it, and so does my family. As an OBGYN nurse, my coworkers and I are experiencing an overwhelming number of illegal immigrant pregnant mothers seeking and receiving free care. Between the volume of patients and the language barrier, insured Americans are not getting the quality care they pay for and deserve. How would a Trump-Vance presidency address this escalating problem?
Wow. Well, first of all, not that this is necessarily the most important issue today, but I think it was a very important issue a few years ago, is maybe our nurses would be less overwhelmed if we didn't have a federal government that was firing people for not taking the COVID shot a few years ago. And whatever your views, I think it was smart to let individual nurses and moms and dads make these decisions, not try to force a one-size-fits-all approach from the federal government. And ma'am, unfortunately, the answer to your question is, if you've got 25 million, 20 million, whatever the number is of illegal aliens in your country, we're compassionate people. We're not going to let people just expire on the streets, nor should we. So the compassionate thing for our own citizens, but I also believe for illegal aliens too, is to stop the open border and stop people coming into this country in the first place. There's no way to solve the problem without re-implementing some strong border policies. And, you know, if you look in the state of Pennsylvania, I believe the last time that I checked, but, you know, I'm sure the media fact checkers will double check my information here, but the average hospital emergency room wait time in the state of Pennsylvania is around 3 hours, right? So you go to the emergency room and you're not getting the care that you need because we diverted so many resources from caring for people who ought to be here to focus on people who have no right to be here. We have to recognize that there are sometimes trade-offs, and the compassionate thing is not to open your border and allow Mexican drug cartels to sex traffic little kids into our communities. The compassionate thing for our own citizens, and I think for everybody else, is to secure the border and focus on some basic common sense law enforcement. That's what we have to do. Thank you.
Thank you.